Dr. Karen Price, if I could start with you, there seems to be an extraordinary disconnect between what the federal government and General Fruin are saying about the supply of kids' vaccine and the anecdotal stories about cancelled deliveries and appointments. What's your take on the situation as things stand today?
Well, really, both are correct. There are enough vaccines in the system. It's whether or not they can get into fridges, and then whether or not the general practice has the capacity staff-wise to manage the vaccine rollout for children on top of what we're already doing. So it's a combination of issues. And of course, we've also got 2.3 million children and their parents trying to get a vaccination appointment, and it probably won't all be done in the first week.
So is it just a matter of logistics, like the same sorts of problems that all sorts of industries are facing? It's just hard to actually get the vaccines distributed?
It is one of logistics and distribution issues, and also one of the workforce issues in managing that. And of course, matching that supply and demand. I heard JJ Fruin talk about that, where it's basically impossible to design a system where you can actually locally pick where exactly the biggest surge in that demand is going to be. But what we've had discussions with, which have been very helpful, is that we're going to try and do some load sharing so that we can start to sort of really match some of that supply and demand at that level.
In general practice, you're facing a lot of pressures. You've got to deal with boosters, kids' vaccines, and people with COVID being sort of put back into the GP system. What are the biggest pressures for you at the moment?
Look, the workload, in a word, and that's on top of having staff furloughed. It's also one of personal safety. So we've been talking about getting adequate PPE, personal protective equipment, so that we don't have more and more staff furloughed. And managing this huge volume of work. So COVID positive patients, as you said, the booster for adults, the vaccine for children. And we've also got, we've still got that extraordinary mental health component, which I was talking to Pat McGorry earlier today about young adults and so forth. We've got a lot of work going on in general practice, and it's certainly not business as usual. We're having to triage and appropriate the resources that we've got to the most needful at the moment.
Dr. Stephen Parnis, what's the story in hospitals? The government says the issue isn't overall case numbers anymore, but whether ICUs can cope. But are ICUs the major issues now, just given the sheer numbers of people presenting?
Not this time, Laura. That was certainly the case in 2020 and 21 in Melbourne, but this time round, it's that we are having really large numbers of people coming through the doors. Even though it's a small proportion needing admission, a small proportion of a huge number is still a big number. And those numbers are having a big impact on the hospitals. Compounding that, we have a much smaller available workforce. Levels of absenteeism through COVID or being a close contact are unprecedented in my experience. And so we are trying to do more with fewer people. And on top of that, we've got an exhausted workforce.
Well, just on that, Queensland reported today that over 2,000 health workers have tested positive for COVID and over 2,700 were close contacts. And similarly, there are 4,000 in the same boat in Victoria. Presumably the story is the same around the rest of the country. The government announced those changes to the close contact rules for health workers last week, allowing them to come back to work if they're not showing any symptoms. Has that had any impact, and what's your view of that change of rules?
I've had personal experience of working with people in those circumstances. I've seen it work and work reasonably. Clearly, we would rather have people who are not close contacts being at work, but we've got to prioritise now. And if the alternative is not having a person trained and able to do the job there, then there are serious risks to the remaining staff as well as the patients who are there, because we're seeing delays now that are putting patients at tremendous risk.
Well, Dr. Price, there's been a lot of complaints about shortcomings in the telehealth funding system. Can you just explain what the impact of that is on GPs' practices?
Well, at the moment, look, most patients are familiar with telehealth using telephone. They're not so familiar or able to use video technology. So we've been asking for a longer emergency use of a longer time on the telephone telehealth. So at the moment we cut off, funding is cut off at 12 minutes. And you can imagine for most COVID counselling, a COVID positive patient, that's inadequate for what we're doing. We also are concerned because during this pandemic, we've had professional services review of GPs being pinged, if you like, for seeing patients who they hadn't seen in the last 12 months face to face. We want those kind of issues resolved so that GPs can confidently, adequately support our patients using telehealth, which is the safest way to manage during this overwhelming use of primary care.
And is there any sign the government's addressing this issue?
Well, we've called a meeting with the government tomorrow, combined with the AMA and RDAA and ACRM, and I hope that we'll resolve some of those issues tomorrow. They're certainly critical issues for the supply and delivery of healthcare services to COVID-positive patients.
Dr Parnis, the government's been saying it's working on a surge workforce plan, which includes bringing in 2,000 international medical graduates. Are there any signs of these plans coming to fruition anytime soon?
I don't think so. These things should have been bedded down a year or more ago, I think. In the meantime, we are trying as best we can to get a tired workforce to work longer hours. We are asking colleagues, senior and junior, to work in areas that they haven't worked in either before or for many years. We are asking people to be patient with us. And I am making a point to all of my colleagues that they are doing their best and that they will be supported through what are really suboptimal circumstances.
I suppose finally, if I could ask both of you, maybe starting with Dr Price, how much of a difference would it make if people were able to access rapid antigen tests for use at home more easily?
Look, it would help in one way because I think it would send a signal to people that they should strongly isolate. And one thing I would say to people watching, if you're not able to access a test and you've got symptoms, you still need to assume that you've got COVID and stay at home. And practice those public health guidelines. So the rapid antigen tests will be interesting to see how they develop. I'm told that by the end of the month we'll have a lot of them, and we're going to have a good way of using them. And that might be for high risk situations and also for staff, as Dr Parnis was talking about in furlough situations where we need to return staff to this critical time. I think we'll develop a good rubric around how to use them adequately.
And Dr Parnis?
I would say that easier access to rapid antigen testing would be of use both to the community in terms of helping keep them away from hospital services, which have to be essentially rationed at the moment, and help staff make informed decisions about when they can and should be at work.
Dr Karen Price and Dr Stephen Parnis, thank you so much for joining us tonight.
Thanks, Laura.
Thank you.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.